Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. In the last class, we are discussing about disorders of the urinary system and we are discussing about approach to hematuria and how we have to approach whenever there is a hematuria in the urinary tract and also in the kidney, in the glomerulus, and as well as in the collecting tubules that we have seen. Now we come to the other part. Now, whenever we have got hematuria, so actually we have to find out from where actually the blood has been come from. Okay, so as we know, the blood may be from the kidney or blood may be below the kidney like ureter, or blood may be from the bladder, urethra, etc. Or blood may be from inside the kidney like renal papilla, calyces, etc. Blood may be in the upper urinary tract or nephrological part like glomerulus. In the glomerulus, it may be from the epithelium, basement membrane, mesangium, or endothelium. And it may be from the lower urinary tract like collecting tracts, interstitial, which surrounds the loop of the Henle, and also ureter, bladder, urethra, etc. Now, what are the possibilities of red urine? See, always whenever there is red urine is there, it does not suggest that always it is blood. So there are some other possibilities are also there. Now, patient complaint is always, doctor, I have blood in the urine. So usually patient come with this complaint, or mother comes, my child is passing reddish urine. Now it may be blood sometime, or it may be some of the factors which are resembling the blood, or it may be any other red colored substances. It may be any other red colored substances. So in other words to say, it may be due to RBCs. It may be because of RBC, or it may be because of myoglobin, because myoglobin also contains hemoglobin, so iron. Or it may be also sometimes because of excess metabolites. Some excess metabolites may also give the reddish color. It may be because of sometimes drugs, some of the dyes or toxins which is intaken, or sometimes blood or any dye is added. Sometimes this is also possible in the clinical setup. Sometimes a caretaker may add the blood to the urine after voiding, okay, for different purposes. So they can add the actual blood after passing of the urine and show to the doctor, see the doctor, the blood is containing reddish urine. So blood is there in the urine. So all these possibilities are there in the clinical practice. Okay. So anyway, so possibilities of red urine are more. It is not always only blood. Okay, always it is not blood only. It may be from the RBC, no doubt. It may be from the hemoglobin. It may be because of the myoglobin. It may be because of excess metabolites, or it may be because of any of the drugs. Many of the drugs they get excreted through the urine, so they can impart a color, reddish color, dyes, toxins, etc. Many times, or sometimes manually the blood is added to the urine for different purposes. Now make sure that it is actually hematuria. This is a very important thing. So whenever we have got the blood in the urine case, so make sure that it is hematuria. The food which is taken by the child, which is changing the urine color, is one of the common possibility. Okay, many times mother is so much worried about this blood in the urine, but actually it is the food which is taken by the baby or child is causing this particular reddish urine. Suppose if you are taking beetroot, okay, or any other food which contains coloring substances, or added with some of the dyes, so this may lead to reddish color. Most commonly the carrot and as well as beetroot, so these are the most common things. Or sometimes the dyed food, that means food which is added with some of the different dyes and coloring substance, etc. So that may lead to the reddish urine. If it is a drug intake by the child, suppose many times so many drugs they can also pass through the urine, excreted through the urine, like rifampicin, so that gives the yellowish color. So many times B complex, this gives the yellowish color. Okay, sometimes even some of the drugs are there which can lead to reddish color also. So if it is drug intake by the child for a new disorder or already existing disorder, okay, so then especially rifampicin, iron, desferoxamine, adriamycin, and metronidazole also, they are some of the drugs which changes the color of the urine. So this has to be asked. Similarly, make sure that is actually hematuria, that is whether it is excess metabolites. Is it because of excess metabolites? Sometimes body produces excess metabolic waste, and that waste has to be excreted through the urine only. So urine color will go into change. Okay. For example, child with porphyria. Child with porphyria. So usually we will see the urate crystals in the pampers or diapers, which looks like blood. Okay. So porphyria is one of the metabolic chromosome, that means genetic metabolic disorder. Okay, so here also we because the urate crystals which are present in the urine, so they get stained in the pampers or diapers, etc., and that gives a red color, and mother may be showing to you. Other metabolic substances like melanin, sometimes methanoglobulin, homogenetic acid, thyrosinosis, so they may also change the color of the urine into red color. Of course, excess metabolites lead into change in the urine color is very common. That is what actually Ayurveda explains in terms of the Kafaja Prameha and Pittaja Prameha. So where they say Kala Meha, Pila Meha, Lala Meha, etc. So there are actually different types of inborn rates of metabolic disorders which imparts different color to the urine. Okay. So anyway, that's a different issue. Now, phenylketonuria and alkaptonuria are the two other conditions which is commonly seen in children. In case of phenylketonuria, the color will go to change. In case of alkaptonuria, the color will be blackish. So like that, standing urine color will go into change. So therefore, whenever we have got a reddish urine, before jumping into the conclusion that this is hematuria, first just exclude that this is not a metabolite, this is not because of the food, this is not because of the drug, this is not because of the toxins, or this is not because of any food dyes, etc. Now, suppose everything is ruled out. Now, what is left for us is it is not metabolite, it is not food, it is not dye, etc. Now what is left is either it is RBC, either it is hemoglobin, or either it is methanoglobin. Now you have to identify whether it is RBC, hemoglobin, or methanoglobin. Now take the urine and do the centrifuge. Now, so how to do this? How to confirm this? Take the urine and just go for centrifugation. Now, after centrifugation, the urine is divided into two parts. One is sediment parts and another is supernatant fluid after the centrifuge. Now you take the sedimented part. If the sedimented part looks red, then definitely it is RBC, because RBC is the one which always undergoes sedimentation. Okay, erythrocyte, that means ESR, erythrocyte sedimentation. That is RBC always undergo sedimentation. So on the sedimentation, if it is reddish looking, okay, definitely the cause is RBC. There is somewhere from the vessel, there is extra vascular hemolysis is taking place, or there is bleeding from some part internally or externally, it is happening. Now, if the sediment portion is also clear, there is no problem. Now you have to take the supernatant fluid. Take the supernatant fluid, and we have to do the dip test, urine dip test. Okay, so in the dip test, actually we use a chemical which is called as a tetramethylbenzidine. Okay, so go for dip test. So when you go for the dip test, if it is positive, then either it is hemoglobin or myoglobin. See, RBC is different, hemoglobin is different, myoglobin is different, because hemoglobin is present inside the RBCs. Okay, so even hemoglobin can give the red color to the urine, RBCs can give the red color to the urine, myoglobin can give the red color to the urine. RBCs coming means somewhere active bleeding is taking place. Only hemoglobin is coming means RBCs are destroyed. Okay, excessively RBCs are destroyed. Therefore, hemoglobin is released into the blood. Anyway, so if dip test is positive, then two possibilities are there. Either it may be hemoglobin or if it may be myoglobin. Now check the plasma color of the child's blood. Now you have to look into the plasma color of the child's blood. What is the color of the plasma of the child blood? If the plasma color of the child blood is clean and very clear, then it is myoglobin. Because myoglobin in the urine comes in urine secondary to any crush injury or muscle injury. So always the history of such injuries is also important. If the plasma color is very clear, then it is myoglobin. If the plasma color is reddish, okay, if the plasma color is reddish, then it is hemoglobin. This is due to any cause, again leading to hemolysis. Okay, extravascular or intravascular hemolysis. Again, find the history. So like this, the identification is very simple. You have to go for the centrifuge. In the centrifuge, we have got sediments and supernatant fluid. In the sediments, if it is reddish, definitely it is nothing but a RBC. And if it is clear and supernatant fluid, if the supernatant fluid, the dip test is positive, then dip test is positive, then it may be either hemoglobin or myoglobin. And if the plasma color is reddish, okay, if the plasma color is very clear, then it is myoglobin. And if the plasma color is reddish, not clear, it is reddish, then it is a hemoglobin. So this is how actually we have to go for this. And if the dip test is negative, suppose, okay, dip test is negative and child is not having either RBC, no myoglobin, no hemoglobin. Okay, now this is the actual thing. If the dip test is also negative, if the dip test is positive, we have two options, either myoglobin or hemoglobin. Then by looking at the plasma color, we can go for that. But if the dip test itself is negative, then definitely we have to think that it is not RBC, it is not myoglobin, it is not hemoglobin. So now we have to look into other causes like maybe food, maybe drugs, maybe metabolites, etc. Okay, now some of the problems are sometimes there may be false negative and false positive dip test. Dip test may be false positive or false negative. False positive dip test is possible if the urine is stored in the bottle containing formalic acid, formalin acid or formic acid, or if the patient is taking excessive amount of the ascorbic acid, vitamin C. If the patient is taking excess amount of the ascorbic acid or vitamin C, then sometime dip test may come positive. Sometimes dip test may also come negative. Okay, so that means if there is a change in the pH, if the pH of the blood is less than 8, sorry, more than 8 or 0, or if the blood is added with any of the oxidizing agents like H2O2, etc., then dip test may also shows negative. So these 2 points we have to keep in mind when we are going for dip test. So this is about how to identify that from where actually the urine is coming, from where actually the blood in the urine is coming. Okay, so whether it is from the RBC, whether it is from the hemoglobin, whether it is from the myoglobin, or whether it is from the other sources like food, etc., dyes, food, medicines, drugs, etc. Okay, so in the next class we will go for the next part. Thank you very much, and don't forget to subscribe my channel, and also please give your valuable comments.